I am Professor Dr. Dharmesh H.S, practicing orthodontics for more than a decade now. I am practicing at Geeta Dental Clinic, Basavangudi, Bangalore. 13 things that you should know before starting your orthodontic treatment, that is your braces treatment. Number 1, orthodontic treatment will correct the improper arrangement and occlusion of your teeth, which may require about 15 months to 30 months based on the type or severity of the condition. All you need is patience. The treatment time will be increased if the patient does not cooperate with all the instructions given by your treating orthodontist. Number 2, there are two types of appliance: removable, which can be removed at the patient's will, and fixed, removed by the orthodontist after the completion of treatment. Number 3, the cost of the treatment varies from one orthodontist to another orthodontist depending on their expertise, complexity of the case, type of appliance used. Number 4, please note that orthodontic treatment must be performed only by a doctor who is MDS in orthodontics. Beware of unqualified, untrained practitioners, as they might not be able to get the desired results, or they might worsen the existing dental malocclusion or defect. Number 5, both removable and fixed appliances need extreme care to maintain it. Number 6, patients who are prescribed removable appliances like plates or functional appliances must wear them sincerely as instructed by your treating orthodontist. Treatment success with removable appliance is based only on one factor, that is your cooperation. Number 7, certain parts of the fixed appliances like elastics, which look like rubber bands, are removable. They must be worn and replaced according to the instructions given. Number 8, orthodontic treatment may or may not require extractions, that is removal of sound teeth for therapeutic purpose. Based on the severity of malocclusion, sometimes extractions, if not deemed necessary at the initial examination, may be needed later and carried out with due consent. That means to say that in the beginning we might start it as without removing the tooth, and later we might require to remove few teeth, which will be done with your consent. Number 9, on completion of the treatment, the aesthetic judgment of the treating doctor will be considered final. Number 10, following appliance removal, your teeth and bone have to stabilize, for which you will be given retainers. These are simple, inconspicuous appliances which may be either fixed or removable type. The cooperation and sincerity you render during the course of treatment must be continued during this retention phase 2 for the ultimate success of therapy. The retention phase may range anywhere between 1 to 2 years. Number 11, in certain pre-treatment situations, special retainers may be needed. Number 12, kindly be prompt in paying the doctor's fees to avoid embarrassments. Number 13, in case you have any problem with the appliance, contact your treating orthodontist clinic immediately. For more information, you can log into my website www.alignersbraces.com, or you can contact me on my phone number 9900008081. Thank you.